Good evening, everyone. My name is James Schofield, and about a year ago, I was diagnosed with a rare genetic disorder known as Marfan Syndrome. So tonight, I want to speak a little bit about Marfan Syndrome. Specifically, I'm going to be discussing what it is, what the signs are, what we have to watch out for, and the treatment options that are available. First thing you're probably wondering is, well, what is Marfan Syndrome? Well, Marfan Syndrome is a connective tissue disorder that affects the tissue and organs of your body. Now, it can affect the whole body, but those are the two main things. I have actually come across two people, one person who was diagnosed with Marfan Syndrome, the other person who was suspected to have it but was never diagnosed. The first person, who is Isaiah Austin. Isaiah Austin is a former Baylor University basketball star. He was actually diagnosed weeks prior to the 2014 NBA draft. The second person who we suspect had Marfan's but was never diagnosed is our very own 16th President, Abraham Lincoln. We suspect that he had Marfan's is because of his extreme height. Now that I have discussed what Marfan Syndrome is, I'm going to discuss what some of the signs are and what doctors really look for when diagnosing Marfan Syndrome. The signs include extreme height, extreme skinniness, which is also known as anorexia, being double jointed, being longer ligaments, being very flexible, and also a dipped in or extended chest. Those are the signs that the doctors really do look for when diagnosing Marfan Syndrome. Now that you know what the signs are, you're probably wondering, well, what are some of the issues that we have to really watch out for when we are diagnosed with Marfan Syndrome? Well, the main thing that we have to really watch out for is what is called an aortic dissection. An aortic dissection is basically a tear in the aorta. The aorta is the main vessel connected to your heart that pumps blood throughout your body. In fact, according to one study done between 1963 and 1992, among 360 patients who suffered from an aortic dissection, 40 of them was diagnosed with Marfan Syndrome. Specifically, 24 were men and 16 were women. Another huge thing that we have to watch out for is scoliosis. Now, according to the Marfan Foundation, 60% of children who have been diagnosed with Marfan Syndrome have suffered from scoliosis. As you can tell, that is a high percentage, so it's a big issue that we really do need to watch out for. The third thing that we really need to watch out for is what is called collapsed lung. Now, collapsed lung is basically when air or gases are trapped in the lungs and causes us to not be able to breathe and eventually to pass out and lose oxygen and end up dying. The final thing that we really need to watch out for is what is called detachment of the lens. Detachment of the lens is basically when the lens of the eyes falls out and you basically can't see. Now, this takes a surgery from an eye specialist to surgically put them back in. Now that you know what some of the major issues are, you're probably wondering, well, what are some of the treatments that can be done to prevent those issues or to at least slow the process down? Well, there are several types of treatments, the main one being medication. Now, I'm on metoprolol to manage my blood pressure. I'm 26 years old and I have to take it on a daily basis. Another one is called Lorazepam. It also controls blood pressure. Some of the other treatments include surgeries, back brace for scoliosis, spinal tap, and of course, we must consult with our doctors and specialists on a regular basis. Also, we need to plan our day according to how we feel that day. One day we might be able to do a whole lot more, the next day not as much. And also, if we have any severe pain, we need to go straight to the emergency room. It is better for the emergency room to tell us nothing is wrong than for us to not have gone and something bad has happened. So now that you know what Marfan syndrome is, what the signs are, what we have to watch out for, and the treatment options, I hope you have a better understanding of this rare genetic disorder. And if you or a loved one suffers from any of the signs, please be tested. It's a huge thing, and it could save you or your friend's life. Thank you, and have a wonderful evening.